All right, so let's talk about the adolescent. So, the adolescent, so this transitional period between childhood and adulthood. So, this period of time where they're not only physically growing, but their brains are cognitively growing, they're socially changing dramatically, emotionally changing dramatically, and adolescence is typically defined as that period of time between when puberty starts and then the cessation of growth. So somewhere around that 20th birthday. Okay, so here is some definitions that you're definitely going to want to know. So prepubescence, about just like I mentioned in the previous lecture, about 2 years before puberty, heralding physical changes starts. Okay. Now, puberty is when that sexual maturity is achieved, and post-pubescence is that 1 to 2 years after puberty. Okay, so skeletal growth is complete, reproductive functions are fully established, and then that adolescence is that time of growing and of social, physical, psychological maturation. Okay, so a few terms here should be review. Primary sex characteristics, these are those external and internal organs necessary for reproduction. And then those secondary sex characteristics are those results of hormonal change, but they don't play a role in reproduction. So, the voice changing, the hair growth, breast development, body changes, particularly in females where those fat deposits occur. So this neuroendocrine portion of puberty. So these hormones stimulate the gonads, and the gonads produce and release the gametes, and then the gonads secrete sex-appropriate hormones, and this is the start of puberty. So we have the sex hormones. Again, you guys have learned about these before. They're secreted by the ovaries and the testes, and of course the adrenal glands. And they're produced in varying amounts by both sexes, male and females, and they vary depending on the age of the person throughout the lifespan. So of course, estrogen is that feminizing hormone. It's very low in production during early childhood. In males, there's a gradual production as they mature, and in females, the levels increase significantly until about 3 years after they reach menarche, and then it remains at that maximum level for the remainder of their reproductive life until they go into menopause. Of course, androgens, those masculinizing hormones, and they're secreted in very small but gradually increasing amounts from about 7 to 9 years. And then they increase in males and females until about 15 years. And these androgens are what is responsible for that rapid growth in the early teenager. The testes secrete the testosterone, and these levels also continue to increase. Okay, so Tanner staging. This is our way, and we are going to ask you about Tanner staging. It's very important that you know about Tanner staging and that you're able to document the proper stage of the child that you're seeing in the office. This is important, like I talked in the previous lecture, for helping that adolescent or that school-age child to know sort of where they are when it comes to puberty, and particularly for females when it comes to their menses and things like that. Okay, so make sure you know these definitions. So thelarchy is the beginning is typically the first sign of puberty in females, and this is breast budding, and it can happen anywhere from 8 to 13 years old. So I really want 8 to be your lower threshold. 8 is a good number to have. Now, when we think about puberty and going into sexual maturation and things like that. We do know that African American females are typically the earliest to go into to start puberty, and they would be most likely to be that child that presented with breast budding at 8. However, it's a good threshold for you to have for when to dig a little bit deeper. Is this precocious puberty and things like that? We'll talk about that in the endocrine chapter, and when we get to that towards the end of the semester. Now, adrenarche, that pubic hair growth, again, 8 to 13 years. I think this is just a good, it should happen between this time. It's a good way of just sort of grabbing it and holding on to it in your brain so that you know when you're seeing kids for their well visits that, you know, if we've got a 14-year-old and we don't have anything going on, then we need to be concerned. And vice versa, if we have, you know, a 7-year-old and we have things going on, we need to be concerned. Now, I saw a kid just the other day. She was 6.5 and she had premature adrenarche. And so I worked her up, and everything came back completely normal. So, you know, it's likely just an isolated pubic hair and not a true precocious puberty. So we do see that. But at any rate, these time periods are important so that you know, do we need to dig a little bit deeper and look at what's going on here? Okay, timeline here. Menarche usually starts about 2 years after thelarche. And I always ask, so have you started your period? No, I haven't. Okay, do you have changes going on? Yes, I do. Okay, when did those start? And they usually say, well, I started getting breast buds at 10 or whatever. And then you can see, okay, let's see what their growth is doing. And let's see, you know, are they reaching that high velocity growth period of time to where, you know, that they're really hitting that stride and they're in that, that heavy growth period. And menarche is probably going to be around the corner or whatever, you know, that time frame is. Then, of course, that pubertal delay, like I just mentioned before, if we have, you know, no thelarche, nothing going on by the age of 13 in females, we need to be a little bit concerned. We need to, you know, maybe be digging and seeing if we need to get an endocrine consult or something like that. Okay, so make sure you understand this. Make sure you know this Tanner staging and that you feel comfortable navigating, sort of identifying what Tanner stage they're in. Again, this is for the pubic hair, the growth of pubic hair. All right, so sexual maturation in males differs. So you can see that it's a little bit older when we would expect them to begin. And 9.5 here on the slide, I would say 9 is an easier number to understand. So for girls, 8 to 13, for boys, 9 to 14. And that should be, you know, pretty easy to remember. Typically, the first sign is testicular enlargement, and then they have a little bit of sparse pubic hair. You know, you'll have penile enlargement as well. Voice changing then begins. Facial hair. Sometimes they do get a little bit of gynecomastia, which is that temporary breast enlargement. It's actual breast tissue that's just responding to the hormones, and those go away in the majority of males. And then, of course, penile growth. They may then be experiencing their first ejaculations. They'll have axillary, groin, facial hair, and then voice changes are pretty solidified. Okay, and this is just those Tanner stages for the males. So during this period of time, we see a dramatic increase in growth. Okay, so as children and adolescents are sexually maturing, their growth is exponentially they're getting much taller much faster. So you can see, you could even look at a growth curve on a child who is in this physical maturation and sexual maturation, and you would be able to tell based on their growth spurt that you should expect some body changes when you go in the room to see them. So 20 to 25% of total height is achieved during this period of time. So it's noticeable on the growth curve, okay? And it occurs within a 2 to 3 year period. Maybe stretched out a little bit more for boys, but for girls, it's about a 2 to 3 year period. And you see this characteristic sequence of changes. It's a very good way of putting it. So sex differences in general growth patterns, they appear to be the result of hormonal effects. So we see this skeletal growth, we see voice changes, we see lean body mass occur, skin changes, hair changes. Okay, skin is a big one for the adolescents. When they start to have acne and things like that, that's one of the biggest complaints that or topics that we talk about during the adolescent visits. So their pulse and their metabolic rate, heat production is decreasing. These adult values are forming because, of course, they're becoming adult size. They have better respiratory volume, vital capacities, and all that. So Erikson, this sense of identity. So we talked about how we're going into this adolescent period, and we're finding ourselves and what our personal identity, our group identity, and this is starting to develop in that school-age child where they're really sort of starting to gravitate towards their peers and find like-minded individuals and those people that they tend to click with and get along with and they fit in with. And this sexual identity continues to develop into this adolescence. Okay, so formal operational period. So this concept of abstract thinking. Okay, so we're able to think beyond the present, and it's funny that that Piaget points out that the adolescent is able to do that, and yet what is that sort of social stigma that adolescents have? Well, they're invincible. They don't realize consequences. They do things before they think through, right? So all of these things that, sort of this rash behavior and activities and experimenting and all of this kind of things. And yet they're developing this abstract thinking and this ability to think beyond the present, and they should be able to sort of connect these dots. And yet for a lot of kids, it doesn't come till much later. Now, this sort of abstract thinking ties in with their sort of concern for what others think, and that then sort of can drive their psychological feelings and depression, anxiety, and all of these things we start to see in the adolescent. The goal for social development is, for them to develop this identity isolated from their parent, and yet still have that parent authority that's there to help guide them, make good decisions, and things like that. But it's very much pulling away from the parental authority, getting that acceptance from peers, and then you have peer pressure. You have those individuals that may not find someone that they fit in with, and so they can experience loneliness, isolation, and things like that. So this relationship with parents can become very tumultuous, and you might experience this in the office when you have a teen and an adult and a parent that, may not see eye to eye. And it's really this rite of passage that it's a beautiful thing as the primary caregiver that we get to sort of accompany them through this.